Hi, I'm Dr. Sneha, Consultant Medical Oncologist at Aster RV Hospitals, Bangalore. On the occasion of World Colorectal Cancer Day, that is March 31st, let's discuss about colorectal cancer. What are the risk factors associated and what are the symptoms with which patients present to us, and also is the screening is useful or not. So coming to the risk factors. The risk factors include, one is definitely age, obesity, alcohol addiction, tobacco smoking and tobacco usage, red meat or processed meat consumption. What are the symptoms with which they present with? Which include bowel habit change, which may be a constipation followed by diarrhea or free passage of stools but not feeling like complete evacuation. Bleeding per rectum, it is not always piles that leads to bleeding per rectum, or recurrent anemias. Sometimes they just present with pain abdomen as well. So these are the most common symptoms with which we see patients in our OPD. Coming to how do we identify it? One is definitely with the help of screening. Screening is for healthy individuals, not the persons with the symptoms. So after one crosses more than 50 years, they can either go for a colonoscopy once in 10 years or a sigmoidoscopy once in 5 years, along CT scan once in 5 years. They can choose any of these things. So at least one time screening is recommended by even our Indian cancer guidelines after crossing 50 years. Coming to how we diagnose colorectal cancer, like I mentioned before, once patient comes with symptoms, altered bowel habits, weight loss, blood in stool, or anemia workup resulting in identification of a polyp or an ulcer in any of the colon or rectum, then we do the biopsy of it and see for any evidence of cancer. Once it is proven, the treatment from colon and the rectum is different. So coming to the colon, suppose if the biopsy is suggestive of cancer, then we do a CT scan to know where all the disease is, and the first one is going to be surgery. Whereas in rectum, suppose if there is any rectal growth, then we do a biopsy. We will see whether it is operable or not, that is whether it is very early or not. If not, it is a combination of chemotherapy and radiation and then the surgery. Then what is the importance of CT scan? Importance of CT scan is to stage the disease, whether it is confined to the bowel or it is outside the bowel or it has gone to elsewhere, basing on which we divide into stages 1, 2, 3, 4. And until stage 3, both colon as well as rectal cancers are curable. For further information regarding screening, diagnosis and even for the treatment, you can visit at Aster RV Hospitals. We are a team of medical oncologists, surgical oncologists, radiation oncologists available for further information and for consultation.